This is the second video in our 9-part educational series about His Choice Vasectomy. Vasectomy offers benefits for both women and men. There's only one reason to have a vasectomy, and that's to prevent pregnancy. Although men have vasectomy for the single reason, men have many different motivations to prevent pregnancy. Vasectomy allows men control over their reproduction. They do not have to rely on their partner to take birth control or worry about the possibility of contraceptive failure. For many of our patients, vasectomy allows them to limit the size of their family, and this allows them to be better providers for their children and spouse. For others, having a vasectomy saves their partner from using hormonal birth control or from having a more risky tubal ligation procedure. Many of our patients have vasectomy because they don't want to have any children at all. Approximately 10% of our patients do not have children. Some men see vasectomy as a personal way to contribute towards the health of our planet by limiting overpopulation, consumption of natural resources, and changes in climate. If you can't understand why limiting overpopulation is a good reason for a vasectomy, then you have probably never visited an overpopulated country in the developing world. Most well-done studies show no significant long-term side effects from having a vasectomy. You may be surprised, many studies show an improvement in sexual satisfaction after vasectomy. This improvement in sexual satisfaction is experienced by both men and women, and this improvement is because vasectomy provides you freedom from fear of an unplanned pregnancy. Vasectomy allows couples a highly effective way to avoid unplanned pregnancy and avoid having to consider abortion of an unplanned pregnancy. Vasectomy allows women to avoid the risk of hormonal birth controls or avoid the risk of the more invasive tubal ligation procedure. Vasectomy allows women to avoid the risk of carrying a pregnancy to term. Women bear all the risk of pregnancy and all the risk of hormonal birth control. Unfortunately, women also shoulder most of the responsibility for having to be the ones to have permanent birth control. Since most pregnancies result in good outcomes, we mistakenly assume pregnancy is without risk. Pregnancy does have risk, and about 1 out of every 10,000 pregnancies can result in the death of the mother. In the developing world, this number is much higher. Women benefit from vasectomy because their partners share in the responsibility of preventing pregnancy. Vasectomy allows women to avoid having a tubal ligation. Tubal ligation is a surgical procedure performed in the operating room using general anesthesia. Vasectomy allows men to contribute to reproductive planning. Tubal ligations fail more frequently than vasectomy, and tubal ligation failure often results in ectopic or a tubal pregnancy. This is a serious condition in which the pregnancy develops inside the fallopian tube. Vasectomy has benefits for both women and men and is the safest and most effective form of permanent birth control.